Shared care means to me that there is an opportunity to create relationships and to create trust for quality health outcomes. Those relationships might be between specialist physicians and family physicians. They might be between the specialist, the family physician, and the patient. But shared care is also about organizational partnerships and relationships, like relationships with the BC Medical Association and the Ministry of Health and the Health Authority, to work on better quality outcomes and to address gaps in care. Shared care is a blanket term, but I think that it happens at the one-to-one relationship between a patient and their physician, whether it be a family physician or a specialist. I think it happens at relationships between different healthcare providers and the team, and how they create an opportunity for sharing the care of a patient, with the patient at the center. Nothing about me without me, being part of that. But I also think it happens at a higher level. I think shared care is different organizations creating authentic partnerships that actually get us to improving healthcare for British Columbians. So I think shared care happens at many levels, but most importantly, it's about delivering that quality care to the individual who is seeking help and requires a team to support them in their care. Well, I think we're very fortunate in British Columbia. Through the Physician Master Agreement, we have a number of tables that we've created, and those tables are looking at buying quality outcomes. In partnership with the BC Medical Association and the Ministry, we have an actual structure, a mechanism and a framework, and the supports there. So we bring to the table our staff and our resources from both sides, and we come together in a consensus model to look at gaps in care and determine what can we do together. So there's will, because we have an agreement to work together and there's a framework to do that. There's the ideas, because we have the right people at the table and we can invite in numerous partners to help us to generate innovations. And the framework that we have is the model for improvement, where we are looking at improving on the system. It's not a pass-fail type of a working relationship. It's about improving on the system that we have. Small steps of change that lead to large-scale improvements, and we have the right people to make some of those system changes because of our organizations. I think what I learned is from a patient perspective, I was really touched by, and I always am, I said the patient voice always teaches us something about their experience. And constantly we're reminded that the public plays a large role in looking at how services are offered in BC. They learn that role, simply we learn about their role by their behavior. You know, people vote with their feet, they go to where they can receive care. If we see people going into emergency rooms or into walk-in clinics, it's because access isn't easy elsewhere. That's one of the reasons. So I learned today that, you know, all of us want a better system. I think I knew that coming into the event, but the more I hear that resonation from the patients and from the physicians that are in the room, the more I know that we're headed in the right direction, and we have the secret ingredient. The secret ingredient to the secret sauce for success is we have the will to make a change. I think the opportunities are about taking those great ideas and melding them together and coalescing them into a system change. So it takes lots of people to shift a culture, and the culture change is happening, and it's not just happening in this room. So there's, you know, over 200 people here today, but across the province, the number of specialist physicians and family physicians that are doing work in their communities, the numbers of patients, families, and caregivers that are working to make a different system, and the health authorities' role. I think really we've got a substantive innovation lab going on around shared care in the province.